have like sheep, cow, chicken.
Chicken, yeah.
What else?
Also, we have turkey.
Taki?
Yeah.
I just got in my room. Look at this. Let me show you. 2 bunk beds, closet here, and a little desk. My question is it just gonna be my room, or am I gonna share the room with other people? Because there are definitely more than one of us. I think there are like 6 of us for 2 months here. So I wonder if I'm gonna share a room or if this room just belongs to me. Probably not. I'm probably gonna have to share a room. We will see.
Uko na Samsung, uko na Oppo, yani simu zote tunakuwekea kwa bei nafuu. Karibia customer.
That's true.
Record.
Were you a hater at first? When I first tried it, I was surprised. You're like, I wanted this to taste different. I wanted it to taste
Good morning. It is officially my first day of school. I am super excited. It's 6:30 right now. The sun is rising up in the horizon and I have about 20 minutes before we have to go. We're supposed to meet at 6:50, walk from here to the hospital, which is about 15-minute walk. I will be with another student who's also doing surgery. In the next 20 minutes, I'm gonna go have some breakfast in the cafeteria. I don't really know what to expect. I was told that we don't have any surgery today, so we are not in scrubs. I was told by the team lead to wear professionals. This is like the only professional clothes that I brought, and I know I should have brought more, but we were under the impression that they mostly wear scrubs, so I did not bring any more extra professional clothes, and I hope this can last me as long as it can. I am just super excited. Last night I couldn't sleep at all. I only slept like 3 hours, maybe because of some jet lag, although it's been like a couple days, and then due to anxiety as well. I don't know, I'm just anxious. Yeah, I don't know what's gonna happen today. It's my first day. I hope that I don't crash from the lack of sleep. I'm gonna go have some coffee, so hopefully that helps. But I don't feel sleepy at all. Like, I'm doing fine. I'm feeling great. I'm just super excited. It's beautiful outside. So it's not as nice, but it's cheaper. People recommend it to have like an immersive experience and to get to know the students there.
Oh.
Interesting. Going into surgery. Super excited. Going into surgery. Here is their locker room. And then they have shower here. I forgot to bring my scrub cap, so I'm just gonna have to wear those disposable ones. And then here are my new clogs. Brand new. We are also supposed to bring our own sterile gloves because they only have 7.5. So I brought my 5.5. It's 2:30 and I just got done with surgery. I'm so sweaty because there's no air conditioning there. I don't know if you can see it, but it's all wet down here. Overall, it was really fun. I got to help with closing the skin and he taught me how to do vertical mattress. I've done it a couple times before, but I wasn't really good at it. So he taught me how to do it again and I really appreciated it. Recently on Instagram, I asked my followers what kind of questions they have about personal statements for medical school, so let's go over it. How to get started. Ask yourself why, like really why. Why do you want to go to medical school, and what are some things that have inspired you to go to medical school that will make you a good doctor or a good physician in the future? So many questions about how to stand out. Focus on significant personal experiences that have shaped or changed you into who you are today. What are some things to avoid talking about? Avoid focusing on one detail too much or focusing on the experiences rather than the lessons that you learn from it. The experiences are important, however, the lessons that you learn from it and how it has shaped you and changed you are more important than the experiences itself. Do you trauma dump? That's a very good question. I would say be careful here. You can include some trauma, especially if it pertains to overcoming adversity. However, don't dwell on the negative. Use it to show how you overcame the adversity and how it's positively impacted you. Does it have to be from personal experiences, or does it have to be willingness or motivation? I would say a good personal statement will contain all three elements. You have to tell your story, and you have to show how you have the willingness and motivation for the goal that you are trying to achieve. I want to take this opportunity to give a shout out to Motivate MD. They go beyond AI and basic grammar checks. They help you craft your unique story. They have very experienced editors, many of whom have actually served on admission committees, which means they know exactly how to make an applicant stand out. They have even gone to different schools to get inside knowledge on what makes an essay truly stand out. With over 100 medical students and doctors from 90 plus med school, their team bring diverse perspectives and deep insights into the application process. They'll guide you through every step from primaries to secondaries to interview prep. And the best part, their services are actually affordable. Other companies may charge 2 to 3 times the amount for lower quality services, but Motivate MD is committed to making application support accessible to students. So if you're looking for an expert for your med school application, check them out. And if you have any questions, Becca is just a call or a text away. I am back in my room. We went shopping and I got a few things, including this dry fish that I found. My mom used to eat something similar, and when I saw this I was very excited. I wanted to try it. And then today is actually one of the students' birthday. I wanted my classmate who is also on a different service, so I got her a book as a birthday gift, and I also got some water and just a few other things. Overall, today was very good. I feel like I have a lot to unpack. It was a lot to digest for a day. Everything was new. I feel like I am in third year all over again. Yeah, at this point in fourth year at my medical school, I get pretty used to the OR. I know how things are, and I know how to best help my residents and my attendings. But here, everything is new again, like the way you drape the patient, the way the OR runs, the way the floor runs, and how to round in the morning. For example, the first thing that happened this morning was, as a med student, we were taking vital signs. Like, I haven't taken vital signs in a long time, and I can count the number of times that I've taken vital signs manually, but that was my job this morning. We took vital signs of all the patients that we had, and then we went around, and then after that it was the OR. Another interesting thing is nothing is on the computer, everything is on paper. So even if you're gonna write note, it's gonna be on paper. Even if you're gonna give order to nurses, it's gonna be on paper. So it's a lot harder to keep track of the patients and know like what needs to be done and what is already completed. Overall, I think the hospital is a lot bigger than I thought, and there are many different units, many different wards, but they have very limited resources here. So for example, there are different units on the surgery, and each unit they will have like 8 beds. They're very close to each other with no privacy. They have curtains, but the curtains were never drawn so everybody can see each other. And on each bed, a lot of times they have 2 people, like 2 completely strangers are on one bed just because there's not enough bed. And so it would be like 8 beds in each unit and 16 people in the unit and 1 nurse who's responsible for it. I think the best part was the residents. The residents were so kind, so nice. They love teaching. I would ask multiple questions even during rounds, and they never hesitate to answer them. I feel very welcome as a student, an outside student, and they speak English for me as long as I am present there, even though that most of them, like the patients, all of them would speak Swahili, but as long as there is someone else who doesn't speak Swahili, they all would speak English. And I feel guilty, but that's very nice because they're very considerate of me and my understanding and my learning. I am overall excited for this rotation. I am so glad to be here. I feel very privileged to be where I am today, where I get to learn from all these experts and get to see a surgery where I haven't really seen before. It really gave me a new perspective. Overall, I love the experience and I am very excited for these 2 months that I'm gonna be here. This is all I have for today. I am now gonna go and eat dinner and then come back and study a little bit. Thank you so much for watching and I'll see you next time. Bye.